When exposing the brachial plexus, the plexus should be divided into two parts: its supraclavicular and infraclavicular portion. Also, if this is a case that requires sural nerve cable grafting, then you will want to be sure and prep out the legs prior to beginning the procedure. Anytime you are using sural nerve cable grafting, you'll want to include the legs in your preparation. The exposure of the sural nerve will be shown later. When exposing the supraclavicular plexus, the patient once again is supine on the operating room table, and a small bolster is placed between the scapulae and the back. The next thing that should be done is a palpation of the sternocleidomastoid muscle. You're going to be interested in finding the posterior border of the sternocleidomastoid muscle. And once this is palpated, it is easily marked out. The dissection will carry down to approximately the sternal notch and the angle where the clavicle meets the posterior border of the sternocleidomastoid. In this patient, it exists approximately here. Your incision will come across the top of the clavicle and in a gentle curve be connected upwards. This then should give you a complete exposure of the supraclavicular plexus. If need be, and you need to expose the spinal accessory nerve, this incision is easily extended to expose the nerve. If it's necessary to expose the infraclavicular plexus, then the medial head of the clavicle is identified and the lateral head of the clavicle. This then, once again, is divided into thirds, and approximately between the middle and the distal third, a mark should be made. This will approximate the deltopectoral groove. The incision, therefore, should then gently curve across this mark and down onto the deltopectoral groove. This then will now give you the infraclavicular exposure of the brachial plexus. By combining these two incisions, a full exposure of the plexus, including the roots, divisions, cords, and nerves, will be affected. It should be noted that the divisions will be approximately at the level of the clavicle. The cords and nerves below, the roots and the other portion of the divisions above.